So, this part will be dealt in detail in your physiology class and you will understand. Usually the gap what I have shown here, it is 10 milligram, 10 millimeter of mercury, it remains like that, this only 10 millimeter. So, equal pressure is maintained and there is not, it is not 7, it has been copied from one picture, that is the reason I am telling you, this 7 is there. But in older books what we read during our times, it is the same pressure, which otherwise without the same pressure, there is some amount of fluid will remain there. So, that is one of the major function of albumin, at least one function you tell, that it maintains the oncotic pressure of the plasma or plasma colloidal osmotic pressure, and that is the most important function of albumin. See, whatever has been written in the book or whatever way things are taught, I am telling you a little bit differently. The simple reason is that I am trying to link biochemistry with medicine and your clinical practices and with the patient care. So, some of the classes might be interesting to you, some might be boring, but if I purely tell the way classically biochemistry is taught and we have been taught also, then the subject will really be boring because it includes only pictures and texts. So, we discussed about the function part in detail yesterday. Composition and solubility, only one part I have told covered, that is albumin. Now, albumin function, oncotic pressure I have told in detail. Now, what is the practical application? Now, if there is, suppose, if there is problem, if the albumin level is low, as I told you, then the colloidal osmotic pressure will be low. So, blood pressure will remain as such. So, this pressure will not be equal, it will be less. So, fluid will accumulate in the extracellular space and that will cause edema. You note down a little bit so that you understand what are the common clinical aspects, because you see there are so many proteins are there. If I go on discussing, there is no end of it. So, among all these things, what I thought that I will discuss this thing. One point I forgot to tell you about the derived proteins, that proteogen peptone was there definitely, but one was there acid metaprotein. If you add acid to a protein, that structure about which I will tell in detail in the next class, that will be totally dedicated and that will be a pure biochemistry class. The higher orders of structures are destroyed, but the primary structure remains, and this type of protein is basically insoluble, and if you add acid too much or alkali too much to a protein, then it can be formed. For proteins, fibrin is formed from fibrinogen. Through a partial degradation, fibrinogen is basically composed of 3 units having or hexamer, from which actually 16 amino acids from 2 of the units are removed. So, basically the derived protein are due to alkali or acid treatment or very partial digestion of protein or hydrolysis. Digestion, instead of digestion I would say hydrolysis of protein. So, common clinical aspects. So, any abnormality of the protein, whatever I have said, if there is any deficiency or if there is any excess, both will cause disease. So, we want everything in the normal amount. So, common albumin deficiency, that disease results in edema. Similarly, hemoglobin deficiency is there. It can be deficiency due to any causes, like we have not consumed adequate amount of iron. So, iron is an important part of hemoglobin. So, it will cause anemia. So there are many causes of anemia that I am not going into the detail. Even somebody suffers from cancer, he will also have anemia, and there are several hematological disorders. Suppose red blood cell is not produced from the bone marrow, then there will be again anemia. So that part is another part, and second is genetic defect. If there is any defect in the production of globin chain, the hemoglobin comprises basically heme and globin. There are two alpha chain, two beta chain in the normal hemoglobin. Now, if there is a defect in the globin chain, so that will cause an abnormal hemoglobin, and that is a genetic defect, and that term is called hemoglobinopathy, not anemia. In those conditions, that hemoglobinopathy, anemia will be there. It will be a feature, because hemoglobin is not produced in the desired amount because of the defect. So anemia will be there. So one of the cause of hemoglobin anemia is also hemoglobinopathy, and this is incurable disease. Genetic diseases, almost, as I told you in the first class, in medical science, basically a handful number of diseases are curable. To be very frank and honest, surgically removed parts like appendicitis you had or gallbladder stone you have had, you removed it, you get cured. And most of the diseases are recovered spontaneously. That is one more important aspect. And only a handful number of diseases can be cured, like infectious diseases only. And other diseases are controllable, like diabetes, like hypertension, like coronary artery disease, like epilepsy. They are not curable disease. They are controllable diseases. And some diseases are incurable basically. Genetic diseases are almost belong to those categories. Immunological diseases can be controlled to some extent. So till date, although diabetes is a very common disease, hypertension is a very common disease, but you can't show any patient who has recovered completely from diabetes or hypertension. So they are kept under control. So genetic defect diseases are basically almost incurable, like thalassemia, like sickle cell anemia. If it is severe, then practically it is incurable. The life expectancy of a thalassemic patient or a sickle cell will depend on the degree of genetic damage. If it is very severe, then he will not survive more, but if the defect is less, then it will survive. I mean, longer period. I will show it to you. Clotting factor deficiency. Clotting factors are all protein in nature, and one of the important example I will say, hemophilia. You have heard that term hemophilia. In hemophilia, there is basically bleeding disorder or clotting disorder, I would say, not bleeding disorder. There is a difference between bleeding and clotting. Bleeding disorders are results from basically from platelet disorder, and clotting disorders result from coagulation defects, coagulation factor deficiency. So coagulation factors are basically protein in nature. So hemophilia belongs to clotting factor deficiency. Similarly, immunoglobulin, all the diseases of autoimmune diseases which you will see in the vast majority of the cases in your clinical practice belong to immunological autoimmune diseases, and they can be controlled. There will be fluctuation, there will be relapse, remissions. One doctor, he will show that doctor is very good. I got, some improvement of great improvement in the symptom, but that disease will not be cured. So the natural course of immunological disease is usually remission and relapse, temporary remission, and this is highly linked to mental condition of a patient, and that part is ignored. Any immunological patient suffering from any disease, you inquire about your psychological condition. Usually there is a tension, there is some problem, and that is that trigger factor for that disease. Anyway, that is another part which I will tell you in the course of time. Infections. When there is an infection, we try to raise our antibody levels. These antibody levels are basically immunoglobulins. Similarly, in cancer conditions which are affecting the immunoglobulin producing cells, If there is a cancer, then immunoglobulin levels will be increased and the abnormal immunoglobulin. It's not a normal immunoglobulin because this cell is a cancer cell, this is not a normal cell. So it will not produce normal proteins. Actin and myosin, you know, these are muscle proteins, and if they are a defect, that is the disease is called myopathy. There is another protein called dystrophin. This is also a muscle protein. That is also very much important, and in the OPD you will see the myopathy cases and Duchenne muscular dystrophy and Becker muscular dystrophy. Duchenne I have seen 4 cases, Becker I have seen only 1 case. I will tell you during Duchenne and Becker's muscular dystrophy. Then protein energy malnutrition. This is another part, that if most of the poor patients do not get the adequate amount of protein, that's why, but they can get calorie from carbohydrate sources. So that causes some amount of malnutrition. However, because of the government of India's many initiatives and public awareness, this type of nutrition defect you will not get here, but maybe in the tribal population you will get, where there is not much awareness and all the facilities do not reach that, particularly the remote forest areas. One book I will show to you that was written by one author from Purulia district. Enzymes, lactase deficiency is a common deficiency disorder in childhood. When the child becomes intolerant to milk, even many adult patients cannot tolerate milk because of the lactase deficiency. And G6PD deficiency will be told in detail. Storage disorders, all the storage disorders, like suppose glycogen. When we take excess amount of glucose, that glucose is stored in the form of glycogen, and enzymes are responsible for storing that thing. Now, when there is a requirement, that glycogen will not be broken down, because if there is a defect in the enzyme, so that will cause a storage disorder. That will be true for lipid, that will be true for other things also. So that is cause a storage disorder. Again, this is due to abnormal protein. If there is a storage, then that is related to metabolism only. So protein as a marker of disease, because during disease there are some proteins which levels are increased. So that increased level is taken as a marker. Suppose there is a cancer, particular protein released from the cancer cells have been released, and that level is increased in the blood. Now you have started treatment. After starting treatment, the cancer cell will die. Obviously, that protein will also level will also decrease. If there is no decrease, that means the cancer cells have not been killed properly. That is another part that will be told again in detail. This is basically an overview of what you will be taught in your future classes. Now, there is a separate department of medical genetics of DM and immunology. DM course is a 3 years post-MD course. This cannot be covered in this class, in this 1 hour class. You can understand the degree of magnitude of the problem. Anyway, coming back to this thing, one part you note down. All the things you will not note down, I will categorically ask. Normal level of serum albumin. You must not forget that 3.5 to 5, some books write 3.5 to 5. This level you must know. Even this question could not be answered during the Viva examination. What is the normal level of albumin? And normal level of total protein, 6 to 8 milligram per deciliter. So albumin level, if it is below that, normally it doesn't occur, edema doesn't occur at a level of 3.5 or even 3. If it is still lower, then only edema occurs. That I will show it to you. When there is an extracellular, as we know, yesterday I was telling that normally we don't have this type of situation. Yes. Milligram per deciliter. Okay, this means 100 ml. This means 100 ml. Gram per deciliter. This is the only parameter which is present in gram per deciliter, gram concentration. Remember, protein is the only parameter, albumin and total protein is the only parameter which is available in the highest amount, highest concentration, and that is in gram concentration. The rest you will get in milligram or microgram. All the common biochemical parameters which you will see, glucose, cholesterol, triglyceride, urea, creatinine, whatever is there, these are all in milligram. So 1000 times less. So remember the unit very clearly. A deciliter means per 100 ml. So normally this is the convention. In the USA country or foreign country, they express the concentration as millimole per liter. But still we are using this conventional term and we are very much acclimatized with this term, milligram per deciliter. Now if you convert it into millimole per liter, then we will also start thinking, because our orientation is not with those figures. Okay? Do you understand? So if that situation occurs, so normally dependent part is the leg. So first it will appear in the leg. It can form a swelling within the abdomen, in the peritoneal cavity, which you will see in the during your anatomy class. Or if there is a generalized edema like this one, from leg it will go on up all the whole body, that is face, facial appearance.
Pustules বা vesicle থাকতে পারে বা
facial appearance,
ইয়ে
when there is a
থাকতে পারে,
facial
secondary
appearance,
infection থাকতে পারে।
you
জাস্ট
just
এইটাই
think that
দু চারটে কোশ্চেন জিজ্ঞেস করে যে কি কে করে, পজিটিভ অর্গানিজম জিজ্ঞেস করে, খুব নামটা খুব ভালো করে জিজ্ঞেস করতে হবে। ওই সার্কোপ্টিস কে যে বানানটা জিজ্ঞেস করতে হবে।
Drag the first up swelling appears around the eyes. So
এই বানানটা জিজ্ঞেস করে।
you will note
সার্কোপ্টিস কে भी ভার হোমিনিস,
I mean swelling or
বানানটা জিজ্ঞেস
edema
করে।
first around the eyes when there is a swelling, because this tissue is very lax. Second, this is from Durgapur Steel Plant Hospital sometime in 2009 March, if I recall correctly, because this was taken from my camera. So the whole body, can you see? This is the picture. There is swelling. It did not be due to albumin, but that may be other causes. But when there is a severe generalized edema, that term is called Anasarca. That note down. Anasarca. Anasarca means severe generalized edema. Generalized edema, it can be mild, it can be moderate, it can be severe. But this is a severe form. You see the size of the abdomen in the even in the lying down position. Okay. So only one of the causes of swelling of leg, face and body is hypoalbuminemia. Hypo means less. Only one of the causes. There are other causes. Only one of the causes. As a biochemistry student, you must know at least two causes which I will tell you. Is hypoalbuminemia. Now, two most common, even this could not be answered. What are the causes of hypoalbuminemia? One is nephrotic syndrome. You note down this part, the three definitions, this part you note down this only. Nephrotic syndrome, there is three defining features. One is edema, that means swelling will be there. Hypoalbuminemia means less albumin concentration, less than 3.5, and proteinuria usually more than 3.5 gram per day. Okay, this is with reference to adult. And advanced chronic liver disease, not simple. These are the two common causes of hypoalbuminemia. Okay, just write down first because this class will be longer. So when there is an albumin deficiency, then how will you treat it? Because albumin is synthesized by the liver. If the liver is defective, albumin is synthesized exclusively by the liver. Albumin is synthesized by the liver. Now, if the liver is diseased, now how this albumin level will be increased? There is no way out. And in fact, during our time, these medicines which is now available for at least last 2 decades were not available. So, for nephrotic syndrome, the liver is not affected. So, liver can be stimulated to produce albumin by giving adequate amount of amino acids, so that it can produce protein, but not in chronic liver disease. So, in chronic liver disease, either you give if you give oral albumin which contains high amount of protein, these are available in the powder form, in commercial form. Otherwise, those who cannot afford this thing, this is a very costly item, 600, 700 rupees per 100 grams. Give them egg only, egg albumin. That will be much cheaper. Okay. So, that oral albumin can be given, and many of the doctors, even when there is an advanced chronic liver disease, they give albumin, oral albumin, but it will take a very longer time, even it may not. So, IV albumin, intravenously, if you give albumin directly into the blood, it will immediately increase the level of albumin. Okay. So, therapeutic uses of albumin will be basically albumin in the oral form and also in the injectable form. So, this is in October 2014, 70 years old lady. You will see the abdominal structure swelling here. Normal level of albumin is 6 to 8 gram and albumin 3.5 to 5.0. And what was that level here? Total protein is 5.5. Normal level is 6 to 8. Total protein has dropped. Albumin is 3.5 to 5.5. Albumin level is 2%. Now you understand why it has happened, and both legs are fractured, bedridden patient, and unfortunately she was my mother, and I could not go home. I kept two attendants there at my village, and they did not mention anything about her condition. My sister went and gave the photograph to me. I had to simply rush to house, take her to an ambulance to our hospital, and this is the condition. You see, immediately after investigation, I did this investigation immediately, and I found that this is a cirrhosis of liver. So after 2 bottles of IV albumin, the legs were, hands were so swollen that I could not insert IV cannula. So I had to, there is a vein here in the leg, you will see that a saphenous vein. I had to cut and insert that needle into that vein so that albumin can be given. And after 2 bottles of IV albumin, on the 3rd day, see the picture, it has reduced significantly. Now, after 3 bottles of IV albumin, on the 8th day, she could stand up. She could sit down and I closed her eyes, that just see, as I want to see whether you are stable or not. On 15 days, she is back to normal. If I would have given her the oral albumin, then this condition would not have been there. This swelling, even this swelling, whatever you are seeing, it is impossible to get within 3 days' time without IV albumin. So there is there is a history. I will tell you later what happened. And unfortunately, she passed away at the age of 84 years. She suffered 3 times of that episode, and every time I gave that IV albumin. Anyway, protein energy malnutrition, as I found. This is found in the poor children. You can see one extreme form is marasmus. Write down marasmus and Kwashiorkor. See, this is with reference to albumin. I am telling you that in marasmus, basically there is no swelling. Albumin level is maintained about 2 to 3 milligram, but in Kwashiorkor it is less than 2 milligram. You have seen my mother's picture. It is less than 2. It was 2. So with that amount, there will be swelling, and you can see the increased edema formation here in the Kwashiorkor, not in the marasmus. Protein energy malnutrition means in malnutrition is there, energy deficiency is there, but in marasmus there is severe deficiency of both energy and protein. means they are not taking adequate amount of food, carbohydrate, protein or fat. So that there is an energy deficiency totally. So calorie deficiency is there as well as protein deficiency is there. In Kwashiorkor, energy deficiency is not there. They are taking adequate amount of carbohydrates, but protein is not in adequate amount. So there is low protein to energy ratio, and that led to the condition. So inadequate or isolated deficiency of protein. If you do not take adequate amount of protein, the essential amino acids will not be supplied, and that is the reason this disease condition occurs. But you will not find this type of condition nowadays because of the awareness, as I told you. And this book was released last year in January 2024 book fair, Kolkata book fair, and I participated. In the earlier days, people took so much effort to get a little bit protein from many sources so that they can survive, and that type of picture is still persisting in the tribal areas of the Purulia district. That's what he has mentioned in the book. So coming, that albumin part is over. So globulin is heterogeneous. Heterogeneous means of different things. Like in this class, suppose if I take the students as a group, faculty is another group, office staff is another group, patients are another group, security staff is another group, then this is called a heterogeneous. It's not an homogeneous. In the hostel, you are staying, it is a homogeneous group of students. But in the campus, heterogeneous people reside. So globulin, unlike albumin, which is basically one category of protein, globulins comprises different types of things. And one is albumin, one is globulin. And see, this globulin part, you see the alpha, beta and gamma. There are three varieties. So alpha has been subdivided into two, alpha 1 and alpha 2. Beta is there. Gamma is again divided into 5 parts. Regarding gamma, you will be told gamma globulin is basically immunoglobulin. You will be told about gamma globulin in detail during immunology class. So alpha 1 globulin, write down one at least, alpha 1 antitrypsin deficiency. Alpha 1 antitrypsin belong to alpha 1 globulin, and if there is a deficiency, that causes a disease called emphysema of the lung. That you note down, emphysema, alpha 1 antitrypsin deficiency, only one. Others, if you can remember, that is all right, no issue. But alpha 1 antitrypsin deficiency, similarly alpha 2 globulin, note down here that thyroxine binding globulin, at least write 3 parts, thyroxine binding globulin, cortisol binding globulin, ceruloplasmin and haptoglobulin, and alpha 2 microglobulin. These rare things what I have written. At least try to remember these 5 points, because it is impossible to remember all those points. Beta 2 globulin, beta 2 microglobulin, you see. 6 hormone binding globulin and transferrin. One point, catch point, MCQ point I am telling you, note down here. Alpha 2 globulin belongs to thyroxine binding globulin and cortisol binding globulin. That belongs to alpha 2 globulin. But 6 hormone binding globulin belongs to beta globulin. That is a catch point. So which category does it belong? It belongs to beta. 6 hormone binding globulin belongs to beta globulin category, not alpha or alpha 2. Or TBG belongs to alpha 2 globulin. Okay. So these are the minor points which you are likely to miss. That's why I am telling you. So third point was protamine. Protamine is important because it is present in the human sperm, and it contains a large number of basic acid, that is arginine and lysine, and it is not coagulable. And there are 2 types of protamines. One is protamine 1 and second one is protamine, family of protamine 2, that is 2, 3 and 4. During one part I told you yesterday that to increase the stability of the insulin, which is having a short half-life, protamine is added. to which zinc is added also to further extend its half-life, so that insulin requirement, injection requirement will be lesser. Otherwise, if you don't add, then the insulin will be destroyed basically. So that is an applied aspect of potassium zinc solution, and this is used to treat insulin deficiency diabetes mellitus. That is type 1 diabetes mellitus. What do we say? This, forget about this thing. Now, potassium, somebody was telling about the plant proteins. Now, categorically, this is an example of plant storage proteins, because we take proteins from plants also. Because dal, cereal, we take, everybody, the vegetarian persons don't take except milk. I don't know in what way milk can be a vegetarian item. This logic is not, I mean, I fail to understand, but they consider milk as a vegetarian item, but they consider dal, that musur dal, is a non-veg item. Peculiar logic. Anyway, so most of the persons who are vegetarian, they take their protein from the plant sources, but plant sources are poor quality protein, I am telling you, that need to be taken in adequate amounts, and this is not taken usually by the poor people. But those who are rich, they can take adequate amount of dal or cereal, pulses, whatever you say, and that will definitely supplement. Here you see, remember, regarding potassium, one is rich in proline but lack in lysine. Again, this is an MCQ point, L for L. So, lack in lysine. Note down this one. So, potassium is rich in proline but lack in lysine. Again, this is an MCQ short question, or what amino acid does it lack? It lacks lysine. That's why categorically I have written. So, gene of corn, these examples you will get. Only thing is that all these things are written in the book. Some points I am telling you so that you remember. Lectins. Lectins are present both in the animals and plants also. So, one of the property is they eat agglutinated human blood group antigens. You just note down this part. Okay. Second, scleroprotein. Scleroprotein is insoluble. Note down this one. This is insoluble in water. These scleroproteins are present in collagen tissue. Collagen is present in bone, cartilage and tendons. And also keratin in nail and hair. And we don't have hooves, but these hooves are present in the animals. So, keratin basically in neck, in nail, hair. So, hair contains also protein. Okay. So, many persons who are having some form of hair fall, hair loss, some proteins are also given, as a nutrient. So, conjugated protein, this chart you will get in the book definitely. I wanted to highlight that glycoproteins, you note down these 3 points, at least blood group antigen or coagulation factors and immunoglobulin. I will discuss about these 2 points, coagulation factors and immunoglobulins. These are clinically important. Lipoproteins, separate classes will be there, and there are 5 types of lipoproteins, and they are differentiated based on their density, and that is done by ultracentrifugation or electrophoresis also. So, nucleoproteins are present in the nucleosomes, nucleocapsid, ribosomes. So, they regulate that histone protein is there around which the DNA coils. So, chromoproteins means color. Some color must be there, that is hemoglobin, myoglobin, even the flavin proteins or visual purples, as I told you yesterday. So, phosphoprotein means phosphoric acid is coupled to amino acid that contains phosphoprotein, and it is present in the milk and in the egg also. It is vital of the egg yolk. Metalloproteins, proteins alone cannot function, as an enzyme. So, they require some metal ions as an activator. So, some are metal activated proteins, metal enzymes or metal proteins also, metal proteins are there. So, then the only thing is that you have to remember the names, nothing more than that. This chart you remember, here you see glycoproteins, and I told you there is a O glycosidic bond and N glycosidic bond. O glycosidic is bond formed with the OH group, and the N glycosidic bond is formed with the amine group. That's it. So, clotting factors, there are 13 clotting factors. Remember, only clotting factor 4 is calcium, which is not a protein. That is basically there are 13 clotting factors, out of which 12 are protein in nature, except one, that is factor 4, that is calcium. So, without these clotting factors, clotting will not occur. Means, if there is a bleeding, clot formation will be not there, so bleeding will not stop. In general, we normally don't say clotting clotting, there is no clotting. I mean, bleeding is continued. There is no stoppage of bleeding. There is no stoppage of clotting. That particular term we don't use. But it can be due to bleeding, I mean due to platelet also, due to clotting factor also. So, এই ছবি তোলা বন্ধ কর, বইয়ে সব লেখা আছে. You will be told all these things in detail. I am telling you for examination purpose what are to be noted and what are not there in your book. Dystrophin gene I will tell you to write down, because dystrophin is not in your book. So, there are 13 number clotting factor, but only that 4 is with calcium, but there are 22 other factors. It is not that 13 factors will function. So, you are reading here, but to make a conducive situation, some other things are required. So, it is like that 22 other things are there for proper blood coagulation. So, their presence is also required. So, these are almost by and large all are protein in nature, and that is the importance of protein. Now, you understand gradually. So, out of the 13 factors or 12 factors, I would say, you note down this one, vitamin K dependent factors. Factor 2, 7, 9 and 10. This is a common question. So, if there is any bleeding disorder, usually vitamin K injection is given to increase the level of these things. I mean, as a method to stop bleeding. Bleeding means clotting here, I would say. Normally, we don't say clotting. Normally, because clotting term is not a common term. So, if there is any bleeding, so usually there is a doctor's, I mean, you will also prescribe vitamin K injection to increase the level of factor 2, 7 and 9 and 10. So, these are vitamin K dependent factors. So, this is vitamin K is available. So, that's why I have written vitamin K is for clotting disorder, not for bleeding disorder. Bleeding disorder is loosely used term. Okay. So, there is a cascade of events of clotting. It doesn't occur. I mean, how these 13 factors perform, you will be told again in detail in the physiology class. So, common clotting disorder, note down the hemophilia A and hemophilia B. Hemophilia A is more common than hemophilia B. Hemophilia A is due to factor 8 deficiency and hemophilia B is due to factor 9 deficiency. And there is another disease which is common disease, which is called also von Willebrand disease. Okay, just note down this one. This common clotting and factor deficient disorder, at least 2, hemophilia A, hemophilia B. See, if this type of genetic diseases occur, then practically there is no cure. If there is a minor trivial injury, bleeding will occur because of a clotting defect, so that bleeding will not stop. So, I don't know or you don't know whether you are suffering from hemophilia A or hemophilia B or a bleeding disorder until and unless this episode happens. Suppose, see, these are the child from Durgapur Steel Plant Hospital, a real picture. See, a child will definitely play. During playing, they sustain injury in the knee and there is bleeding. And you see the huge clot inside. If the clot is outside, you can remove it. Now, can you imagine the condition? There will be damage to the knee, and that will happen to everything, any joint. Even normal movement. Somebody will play, a child will definitely play. And during playing, somebody will note that there is a swelling around the joint, or there is a minor injury, that area is swollen because bleeding has happened there. So even a CSF dress you can see in the adult stage, he is also having this bleeding in the knee because CSF person, central security force, they have to work. And you see, usually therapies are given. So fortunately, you see the child, psoas bleeding. This means there is a psoas muscle inside. This thing which flexes, this if you see, it doesn't really flex, but the muscle is extending from the spine down to the, it is getting inserted here. You will see, read in the anatomy hall. So this is a classical case of psoas bleeding. This, if you lie down, that part will be a little bit depressed. But you see here there is a bleeding. You see there is here is a psoas muscle. But can you imagine what is the condition of this child? Baby, he cannot flex his leg. Now, must therapy. See, you just wait a little bit because I will cover many things. Otherwise, it will take time. These are not in your books. This is not written in the biochemistry book. Just to make you interesting biochemistry, I am telling you all these things. Otherwise, those things, factor 8, 9, if I tell, you will be totally bored. So, fortunately, factor 8 injection is available now. Now, this injection can be given in factor 9 injection, sorry, this will be factor 9. Factor 9 injection is also available. So, you will inject. Now, how long you will inject? I mean, there is no end of it. So, basically this type of disease like thalassemia, or you can see a thalassemia or hemophilia, these are all genetic diseases, these are incurable. So, it is better not to give birth to an affected child. Okay. So, that is why prenatal DNA diagnostic must be there so that the mother does not give birth to a defective child. The keeping in view, because of in Durgapur, we had a hemophilia society. I had an ambitious plan in 2002. I had been in Sanjay Gandhi Postgraduate Institute of Medical Sciences, and I gave a research proposal to make a prenatal DNA diagnostic center for Eastern India at Durgapur in 2002 to Ministry of Science and Technology, to Department of Biotechnology. And this was approved by the Sanjay Gandhi director because he took interview in presence of 13 other members. Somehow I qualified. And the project was approved from the SGPGI, and you can see that it was displayed in the Hindustan, it was projected in the Lucknow Hindustan Times, both in Hindi and English version, and it was displayed in the SGPGI that a new center of prenatal DNA diagnostics will be set up at Durgapur Steel Plant Hospital, and where I was the principal investigator. Unfortunately, DBT did not approve this project because of politics. So, people do not want to work. If you want to work in the periphery, grants will not be given. Even today, this is 2025, this is not in sight at all. This I planned 25 years back. This was my article which was published also in the Medical Journal of Genetics. Say, I wanted to take only 1 or 2 ml of blood from the mother at 5 weeks of pregnancy, when the mother will not know that she is pregnant, and from that I will collect the DNA, and from the DNA the genetic defect of the baby can be diagnosed. That was my ambitious project. So, unfortunately, it did not happen. Like anemia, I told you, anemia, if you look at how will you see that it will look pale. So, anemia will, if you compare suppose you are a doctor and this is a patient hand, you compare, you will get an anemia, or you can see in the palpebra You see, look at the palpebra. Here, see, this is anemia, basically less hemoglobin. This is thalassemia. Again, this is a curse to the family. If the family is born with a thalassemic child, that means the family will be totally disturbed at 21 days interval. The baby, if there is a major, thalassemia, major type of thalassemia, it has to be taken for blood transfusion. Now, how long? And what is the life expectancy? What is the quality? What will be his education? So, just I wanted to prevent the birth of this type of child by doing that project. If that would have been approved, there would have been at least some decrease in the incidences of those genetic diseases. So, my opting biochemistry was not to teach you or not to do this blood sugar, urea, creatinine, but to do some kind of advanced research. Unfortunately, I could not do it. So, in thalassemia, because there is a reduced or absent production of globin chain. So, hemoglobin is having 4 chains, alpha chain, beta chain, normally in adult. Now, if there is a defect in the alpha chain, that is called alpha thalassemia, or reduced production. If there is an absent or reduced production, that is called beta thalassemia. So, in 2001 and 2002, I wanted to also have a detailed study and DNA-based investigation, not normal investigation, but DNA-based investigation. And that's why I tried to read a lot of books, and I spent almost 1 year time on reading this thalassemia, and I read this book, but when I found this book, this thalassemia syndrome book, this is almost a 4-kilo book, and I got lost into myself that it is better to close this chapter. I cannot understand even thalassemia disease. Thyroid, I did a PhD on thyroid, primary hypothyroidism. Then I understood that I cannot have a mastery of hypothyroidism. Tried to have an idea about thalassemia, again got into lost. I have read several books, but these are 3 main. So, Duchenne muscular dystrophy. First case I saw in 1993 in Durgapur, and I told the father that your son is not going to survive more than 20 years. So, plan for a second child if you have, but I know this is a disease which affects male, mother is the carrier and son is the sufferer. So, they are having one son and one daughter. I brought the father, mother and daughter, and this fellow also who suffered from that Duchenne type of muscular dystrophy. The CPK level, which is normally up to 200, it was 16,000. So, immediately I made a diagnosis because the patient's clinical picture was like this. There is abnormal swelling, increased cuff hypertrophy, and that raised a doubt. And this is a typical posture. If you ask to stand up from the sitting position, the baby will rotate here, roll here, he will move this thing, and then he will make this type of posture. This will be this typical, and that was found in that baby. And the moment I told that your son will have a miserable life and the structure will be like this, he will be wheelchair bound. Can you see his condition? I mean, you have to see your daughter's level, your wife's level. They are normal. But this boy was next to, the family was residing next to me. Fortunately, he survived 28 years because of adequate care, and ultimately he was wheelchair bound by the age of 16 years. So again, DMD cases at SGPJ as a worst experience, that when we wanted to prevent the birth of the child, by this time the mother used to know that he is a male child, only the male child suffers. Then the mother said, no, I will not get my baby aborted because this is a male child. Let me have a male child, defective male child, I don't bother, but I don't want to abort. So that genetic counseling part was also at lost, basically. Anyway, myopathy, again, you see muscle, there is a defect in the actin and myosin. So again, you will get the proper muscle functioning will not be there. So that's why you need to read biochemistry in detail, because these diseases has to be prevented. The main cause, root cause is there in the main functional proteins. So you have to find out some amount of treatment for those hapless child or patients you can see. So, sickle cell anemia, I note down one point. This is the only part you note down right at this stage, because it will be told in detail. It is at 6th position of beta globin of hemoglobin. Glutamic acid is replaced by valine. Valine is a non-polar amino acid, and glutamic acid is a polar amino acid. And now see the importance of the classification of amino acid. Now, if you replace something, a polar acid by a non-polar acid by a polar acid, or polar acid by a non-polar acid. Now, see the situation here. It was glutamic acid was a polar acid, means it was on the surface. Now, it has been replaced by a non-polar amino acid. So, that is the reason normally RBC shape is like this. It becomes sickle shaped. So, that is called sickle cell anemia. And normally, we carry oxygen, but the oxygen level is not carried out that much efficiently as it is. So, blood, it suffers from sickle cell anemia. So, abnormal serum proteins, if there is an abnormal globulin level, so that will cause abnormalities, and these are detected by electrophoresis, or better to have a high performance liquid chromatography. You just note down these two points, that abnormality, only this part, rest I am telling you. See, protein, this I have told you 5 classifications, so that has to be fragmented, separated. So, how this separation is done? See, you see, there is a technique called electrophoresis, and the bands are shown like this. So, M band, they write down one part, only one M band only. These will be separated. In the electrophoresis, this will be told in detail. Now, this will give an electrophotogram. Now, here you will have to see which part of the protein has been increased, which fraction, that particular fraction, there is a measurement of albumin. We can measure chemically. We cannot measure globulin. We measure total protein, we measure albumin, and we subtract total albumin from total protein to get globulin. But what are the different fractions of globulin? How will you know? And this is the method how it is known. So, ultimately, basically, which fraction of that protein, the alpha 1, alpha 2, beta, gamma, this albumin is present in the highest concentration. So, it will give a peak. Suppose if there is a, instead of alpha albumin, if there is a alpha albumin peak is there, or globin peak is there, that means that protein is also increased. Okay. So, this is the, so myeloma protein, I am, because of the short time out, just note down these points, this will be required. This can come as short note, take a little, write down a little fast. Myeloma protein is a plasma cell myeloma. It produces these highlighted things, you just write down for the timing. It is a cancer of the plasma cells. And the abnormal plasma cell produces abnormal antibodies. As I told you, cancer cell will produce. This is called a monoclonal gammopathy. If only one cell is involved, that is called a plasma cytoma, and the more than one is called multiple myeloma. The clinical features are CRAB, hypercalcemia, renal failure, anemia and bone disease, and multiple punch. Okay, leave it. I'll better not to. So, there is another protein called protein component protein, acute phase proteins, because you are also restless, I understand. Tumor markers. These tumor markers will be told you in detail, but these are protein in nature. So, derived protein, as I told you, this part I have told you, that peptide, protease, peptone I told, metaprotein are formed from basically acid or alkali treatment. Shape, there is one part, shape, albumin and globulin, these are from globular proteins, globe-like structure. So, they are called spherical proteins. Okay. So, spheroproteins, and they form colloidal structure because they don't remain in the solution because of the large size. So all the proteins form a colloidal solution, not true solution. And fibrous proteins are needle shaped. You see collagen, elastin, keratin, they are categorized under fibrous proteins. So you see look at the classification and the nutritional value, nutritionally rich proteins, incomplete proteins and poor proteins. Nutritionally rich proteins means those proteins which will provide all kinds of essential amino acids. And egg is a reference protein. Milk is another one, meat. These are the nutritionally rich proteins or incomplete proteins because poor persons, as I told you, they can take rice and pulses, bhat dal, khai. So the rice is deficient in methionine, pulses are deficient in methionine, and cereals are deficient in lysine. So they complement each other. I used to remember like PM, Prime Minister, pulses is deficient in methionine and CL means casual leave. Cereals are deficient in lysine. That's how I remember from my third year class because so many things I have to remember. So poor protein which is lacking more than one essential amino acid. So that contains corn, the gene from corn. So if somebody, a poor person takes rice and dal in adequate amount, that there will be not protein deficiency. Inadequate amount, I repeat to say. But most of the protein take rice adequate amount, dal in less amount or pulses in less amount. So there will be some amount of, again, that protein energy malnutrition, Kwashiorkor type. Do you understand? So biologically important peptides, you will get it. I will, tell you in the next class perhaps. But if I don't think bioactive peptides, I will tell you these two parts are left. You are restless, I understand your problem, but this you read it from the book so that next time I teach this thing very quickly.